Hello, my name is Raymond Breton. I'm from Post University. Suppose you go to your doctor and just going in for a routine checkup, and during the process he discovers that you have a life-threatening illness, and the only way to take care of this illness is through immediate surgery, and this surgery is going to require a large loss of blood. And he asks you the age-old question, would you want a blood transfusion? Many patients are uncomfortable with this question, and really anytime a person is faced with a large medical procedure such as this, the question always comes up. We live in a parallelistic society right now where the patient has their own views of medical treatment, and the doctors do too. But it's the surgeon's job to carry out the patient's wishes and to preserve life. At first, the idea of not accepting a blood transfusion was held as anti-medicine because it is viewed by many surgeons as the gift of life. So because of this, a lot of surgeons do not want to perform surgeries without the use of blood. But is this how the patient feels? Notice what one professor wrote, Professor Lawrence Goodnow. He says, when conversing with his patients the day before surgery and asking them whether they would prefer to or not to have blood transfusion during their surgery, he said the answer is always no. And even another professor, Professor Roland Hetzer, brought out that at least 80% of his patients prefer not to have blood transfusions. Why do patients feel so strongly against blood transfusions? Well, there's one thing that both physicians and patients can agree on, and that is the fact that blood transfusions can be dangerous. There are blood-borne pathogens such as AIDS, HIV, hepatitis that can be transferred through another person's blood. Also, reactions, post-operative reactions from the blood transfusions, and also getting the wrong blood can prove fatal for a patient. But we've considered all the negatives of a blood transfusion. Are there alternatives, though, to having a blood transfusion when a patient is faced with this situation? Well, there are actually a number of alternatives, and I have them outlined here. The first one is hemodilution. Another one is cell saver or cell salvage. And the last one is EPO, which stands for erythropoietin. The first alternative here is hemodilution. And I thought the best way to explain this concept is by demonstrating it for you today. And so here we have a half a cup each of liquid, we'll say blood in this case. And this is our preoperative blood right here, and this is our postoperative blood. Now what happens with hemodilution is before surgery the doctors dilute the blood by replacing it with different fluids, and let's say we'll go up to 4 cups here. So your blood is diluted down with these other fluids actually before the surgery. And so as you can see, your blood is diluted down. That way during surgery, say if you lose say maybe a cup of blood, you still have blood volume, and what happens with is for what you lost for blood, it's only a little bit of blood because the rest is all fluid. And after the surgery, what happens is the extra fluids are drained out and you're back to your pure blood as seen here. The second way is through cell saver, which unfortunately I don't have a cell saver machine with me, but what it does, it's actually an extension of your circulatory system. During surgery, the blood is suctioned off as it flows out. It's run through a machine which cleans and purifies it, and then it's sent right back through the body. So like I said, it's an extension of the circulatory system. That way the blood lost by the surgeon is not lost by the patient. The third alternative is erythropoietin, or EPO. And this is a hormone found in the body and actually in the kidneys, that's part of the bone marrow, where the red blood cells are created. And it is administered before surgery and builds up a patient's blood stores. It stimulates the production of red blood cells. So these three alternatives really are a good medical practice today for anybody contemplating the medical procedure and whether to go with a blood transfusion or whether not to go with a blood transfusion. In fact, these alternatives are becoming so widespread that the idea of having transfusion alternatives won't really even be novel anymore. Really, bloodless surgery will be the gold standard of the medical community, and it will be beneficial for all patients.